Hi, Taylor. I'm Dr. Ashley Smith. How are you?
Hi, Dr. Smith. I'm pretty good. A little nervous, I guess.
That's totally normal. Everyone's a little nervous before their first visit. I'll do my best to make you feel as comfortable as possible. First, I'll wash my hands and then I'll pull up your online patient chart. Okay, I'm looking at your chart and see a note here that you'd like to talk about your sexual health. So, tell me, what's on your mind?
Wow, I'm really nervous to talk about this, but I know it's super important. My partner and I were thinking about having sex. I think I'm ready and I want to be as safe as possible.
Well, you've come to the right place and I'm happy to help. Would it be helpful if I gave you a quick overview of how we can support your sexual health and well-being?
Sure.
Sexual health care is important at every stage of life, especially when you're a teenager. Sexual health care can include overall wellness checkups, gynecologic or pelvic exams, prescribing birth control and emergency contraception, making sure you're up to date on vaccines like the HPV vaccine, testing and treatment for sexually transmitted infections or STIs, pregnancy testing, reproductive health care screenings, and referrals to other specialists as needed. You may be able to access sexual health care through your family doctor or primary care provider, or local health department or family planning clinic. So, when should you schedule a visit? If you're thinking about becoming sexually active or are already sexually active, it's a good idea to see your doctor for a sexual health visit. It's totally normal to feel nervous about visiting the doctor, but know that your provider is there to help you, not judge you. If you ever feel judged, you can find another provider who will support you. If you want, you can ask the office if you can bring a family member or friend with you to your appointment. If confidentiality is important to you, you can call in advance to ask if your parent will be told information about your visit or allowed to see your records, and if your parent will see the bill if you have one. Because of HIPAA laws, your provider must keep your health information private. Some states have laws that require your parent to consent to your care, others don't. Also, if you use your parent's insurance for the visit, they may receive an explanation of benefits in the mail that shows the insurance company paid for things like an STI test, pregnancy test, or prescribed birth control. If you don't have health insurance, some clinics or health departments offer care at little to no cost. There are also helpful apps and hotlines that can help you access STI testing and track your menstrual cycle if you have a period. During your visit, your provider may ask you questions about your past and current sexual and reproductive history, what protection you use if you're sexually active, if you've ever been tested or treated for an STI, if you've ever gotten the HPV vaccine, if you have any medical issues or allergies, when your last period was, and if you have irregular periods, if you smoke, drink alcohol, or use drugs. While it can feel awkward, it's important to answer these questions as honestly as possible. During your visit, your provider may also check your blood pressure, listen to your heart with a stethoscope, ask for a urine sample, look at your genital area to make sure everything looks healthy, perform a pelvic exam if you have a vagina, give you a pap test if you have a cervix, examine your breasts, examine your testicles for signs of testicular cancer. Your appointment is also a good time to ask questions like, what birth control methods are right for me? Is my period normal? Should I get tested for STIs? How can I protect myself against STIs? What should I do if I frequently feel sad or anxious? Is it possible that I could be pregnant? Should I be worried about this lump on my genitals or breasts? What should I do if I've been sexually assaulted or raped? What should I do if I don't feel safe at home? So, Taylor, that's an overview of how we can support your sexual health, which is an important part of your overall health. I'm glad you came to see me today. So, what questions do you have for me?
Thanks so much, Dr. Smith. So I do have a question about...
For more sexual health tips for teens, visit centerstone.org/teen.